Hey, Dr. Shirley here with Level Up. I often get asked by patients what sort of insurance I recommend, and I recommend PPOs over HMOs. The reason why I do that is because you get a lot more choice. With a PPO, you can see any provider, whether they're in network or out of network. And people don't understand that even if you have like an HMO or a PPO, either you still have a deductible you have to make per year, which means you have to pay out of pocket a certain amount before your insurance starts kicking in a benefit. Usually the average is $3,000 to $5,000 per year. And I'm a primary care doctor, and patients don't see me that much in a year to hit that $3,000 to $5,000 mark, and so you're paying out of pocket anyways. So I just want to make that clear because people don't realize that, and people definitely want to see someone in network to save money, but you also have to remember who it is you're seeing. Okay, so now let's talk about hospital access. The main reason why I recommend PPOs for hospital access is that it gives you the option to transfer. If you have to go to another facility because they do a procedure there and it's not done at your own hospital, that's super important. So an example that I give people is my dad. He had a heart attack and he went to Hoag because that's what his insurance is in network with. But once he got there, the cardiologist said that he needed a procedure that was done at UCLA, and we couldn't transfer him there because of his insurance. All right. So with his HMO, he had to have just gone directly to UCLA, and that would have been fine because that would have been an emergency. But once he was already admitted, we couldn't transfer him. So for that reason, you never know what sort of specialist you have to see and what sort of facility you want the option to be able to be transferred or to go see someone else. In terms of seeing hospital, in terms of whether or not I like private or public or academic hospitals, I generally like academic hospitals. I live in Orange County. I like UCI. I like UCLA. I like that there are teams that are integrative. You get a more of a holistic approach. You get different sets of eyes looking at you. It is a much better system of care than a fragmented approach. Also, at an academic hospital, you always have a lot of staff there at all times, so you don't have to worry about attendings being there or not. I personally recommend that my patients and my family members go to academic hospitals. I get that it's really tricky when you're navigating the healthcare system, and I hope this helps a little bit.